I am Pastor Gregory Johnson. I'm the co-founder of the American University of Health Sciences. As a Christian-based university, we have God at the forefront of everything we do. We pray before any meeting.
We concentrate as a minority serving institution, which is also faith-based. We concentrate on educating students who come from underrepresented ethnic and racial minorities.
People that are either growing up in Compton or growing up in East LA, if they don't have a chance to see their dreams or they don't have a chance to wish about things and see those wishes become reality, it's a very frustrating and deafening environment to grow up in.
Every faculty, staff, and student gets the opportunity to do research. Research here at the university in clinical levels and then out in the community.
This program is patient-centered. And our goals and everything we think about, etc., is tied into the patient. Because what I've learned through the years is you can know a lot of things about pharmacology, psychopharmacology, etc., but you really don't know until you start really working with people.
We also have faculty who are engaged in different kinds of research that would be alternative to what would be traditional medicine.
I chose the school because it stood out to me because it was a private school. The program is really fast. I mean, 3 years and you're completely done.
The small class size for me, to be able to get to know my professors, to be able to speak to them freely whenever about anything, that to me is the most valuable thing about here.
I'm in class here and there's only 20 other people in this class with me, and that's great. Before this, I did my prerequisites outside at a community college, and in my chemistry class there were 90 other people with me.
Even though they're professors, they're fun. You know, they're people too.
We're family here. We know each other, we help out each other.
Like, I see that this school, you know, does have a mission. And like, that mission's not just to get us jobs, not just to, you know, get us, you know, money. It's for, you know, the good of the, it sounds cheesy, but the good of the world, you know, just to help others.
We have a myriad of programs here, which includes the School of Nursing, a anticipated School of Pharmacy. We have a master's degree in clinical research.
The Bachelor of Science in Pharmaceutical Sciences is our new course that has been launched here at AUHS. It's just over a year old, and the way this was set up is to provide an undergraduate training platform for those who are interested in healthcare careers.
It's very unique that our students have to complete community service hours, and when they complete those community service hours, they're actually working out in the community, working with the homeless. We have different opportunities like acts of love.
Well, acts of love to me are random acts, you know, or intentional acts where you actually try to demonstrate your compassion. In our acts of love, you know, every quarter we feed families, you know, that are borderline, either borderline homeless or they make choices between feeding their children and keeping a roof over their head.
Our school focuses on a lot of community outreach events. We do a lot of screenings here.
And in 2011, we actually sent 2 groups of students to Jamaica. And when they were in Jamaica, the students were working with sick children, working in orphanages.
I think what I love is that I see these successes of students and the little things they say to me, how much it impacts me, and the fact that we can use these resources from a business perspective, you know, not from a nonprofit, but from a for-profit perspective, and we can actually choose to make a difference. We can have a social conscience.
This is a place where there are people who are excellent and experts in the field who care about making a difference. Come be a part of our team.